And I'm Mabel John. You're watching Health Day Live, the streaming video service of Health Day. States are reopening, but the coronavirus is still here. Are people still being infected with COVID-19 at a concerning rate? Is that number getting better or worse? I'm joined now by two experts, Dr. Thomas Giordano, head of infectious diseases at Baylor College of Medicine, and Dr. Marjorie Jenkins, Dean of the University of South Carolina School of Medicine, Greenville. Thank you to you both. It's so great to see you. Now, let's start with you, Dr. Jenkins. In this week's tally, we saw generally that there are more confirmed cases, but it seems like hospitalizations are either holding flat or declining. What does that really say? Where is the U.S. and where is it truly heading when it comes to battling this disease? Dr. Jenkins.
Well, I'll take the first question, the first part of that question initially, and that is that we are seeing a skew in the demographics of the COVID positive cases toward younger populations. So we, in the initial, if you remember the initial data that we were getting out of China and Europe, it was the older populations that were really being impacted by this disease. And in fact, in the beginning, we felt that it would be much like the influenza that would impact those at highest risk, which would be the very young, the very old, and those with comorbidities. So, and that played out earlier in the COVID during the pandemic in the US, which was the elderly populations, which we heard more about. We're now seeing a skew in demographics toward those younger than 40. And we're seeing more mild and moderate cases of COVID, which do not require hospitalization. So I don't know that it's exactly that hospitals are learning how to manage this disease, because they are learning over the last 100 days, but it is also sort of a different skewing of that disease to mild and moderate. We are also seeing a significant impact in our 20 to 30-year-olds in the number of cases. And that reflects, I believe, the activities that you see going on across the nations as states are reopening.
Right.
And you do see the younger populations gathering, on whether it's on the beach or for graduation ceremonies, even as we've seen pictures of people gathering in restaurants and other places and not social distancing. Right. So I think that really is painting a new picture of COVID and where we are now. Mm-hmm. I believe that we are learning every day from this disease. We're learning from the data. We've had wildly, different predictions, right, of morbidity and mortality around this pandemic. And I believe all the people who are putting out those models are doing the best they can. But we are really in such an unprecedented time. Everyone speaks about the Spanish flu, right? And I think that, and we're in a pandemic, but we now have, increasing technology and day-to-day tracking of cases. And I think that's really helping us to paint a real-time picture. And we're having to pivot things that we know, like surface transfer, which we know a lot more about versus, and also masking and wearing those face coverings. So those are all really important data-driven, things that we can do for this disease. But it is an ongoing picture and very fluid at this time.
Well, Dr. Giordano, let's go over to you. In Texas, where you are, we're seeing the number of people sick and hit another high in your state. Would you attribute that to the community spread because of the reopenings?
Well, I think you have to. We're seeing increased hospitalizations here in Houston and across the state, and the state has been in the reopening phase now for about 6 weeks since early May. So we're seeing, as other places are, younger patients in the hospital. And maybe that's because of the reopening. Maybe it's because the elderly are figuring out that this is a very serious condition and needs to be avoided. But the numbers are impressive here, and not in a good way. There's the meatpacking experience, those plants that had big outbreaks. There's the There's the jail and prison populations that have had big outbreaks. There's the nursing home situation across the country. All of those are happening here still, but I think because those are dramatic, we can actually, we know those are happening. And in the numbers in Texas and the numbers in Houston, if you take those out, there's still more cases. And the only reasonable conclusion from that would be that it is because of the reopening, at least in some part. There's community transmission.
Okay, so did we do this too soon in some places?
Well, that's a great question. I don't think there's an answer for that. I mean, if you think about the lockdown happened because the virus was being transmitted with zero interruption, right? There was widespread transmission in New York and in some other areas in the Northeast, as well as other communities on a smaller scale. That was a natural history experiment. We know from that if you do nothing, this virus will wipe through a community in a very devastating fashion. So the lockdown had to happen. Whether it happened at the right time across the country is open to debate, but it had to happen because we needed time. We needed time to develop testing technologies. We needed time to increase bed capacity. We needed time to understand more about the virus. We needed time to figure out how to move forward, what protections would work. And we needed time to develop capacity for contact tracing. So the lockdowns worked. They did what they were supposed to do. We flattened the curve. We kind of relieved the acute shortage of beds in the areas that had them. And now we're opening. And I think that there's a misconception, though, that opening means going back to normal. Opening means resuming some activity so that we can get our kids in school and get back to work. But it doesn't mean life is just like it was last fall. It's a new normal.
Yeah.
It'll be really interesting. Texas opened earlier than a lot of places and is now seeing an increase in cases. New York stayed shut for a long time. Cases are really low. And I think it's going to be very, very interesting to see what happens as New York opens. Can they do it safely in a way that protects the elderly and keeps people employed and in school? Or is it just as soon as you release the clamps on this thing, it's gonna spread? Okay. We know how to prevent transmission, and we have to be smarter about that.
So I would add to that, Mabel, if I may. I would add that we're seeing record numbers in our drive-through testing facilities, and people are much better informed about testing and about symptoms and loss of taste and loss of smell. And so we are also seeing increasing numbers and some increase small in hospitalizations here. But we do have better informed, the public is better informed about this and where they can get testing. And so we have lines of cars waiting in our testing centers, whereas, as you know, we had very little testing in the 3 and 4 digits in some states earlier in the pandemic, and we're now in the 6 and 7 digits. So I do believe that we're adding to those numbers and informing people that they are positive at a much higher rate. I don't know if Dr. Giordano would agree with that, but that's what we're seeing here.
Now, you are also seeing records broken where you are in South Carolina, Dr. Jenkins. Are we seeing people making wise choices while they are out? You did mention that there are more people wearing their masks and so forth, but when people are gathering, there seems to be little crowd control. That is going to be a challenge going forward. Perhaps.
Right, and I think there's a great public health opportunity here and public service opportunity that we have to create messages around responsibility and about being safe and healthy. And when I myself go out into the public and I wear a mask and I try to socially distance. But what you're seeing in these counties where you're seeing these really high numbers that are going up, you're seeing population density, Mabel, and you have populations there. And so I agree with Dr. Giordano about New York. It'll be very interesting to see how that evolves, because there is, we know close proximity, we know not wearing a face covering. Those sorts of things this disease is very infectious. It's very contagious. It transmits very rapidly in those conditions. And I believe we all just have a great responsibility for our fellow man to really take care of ourselves, follow these rules. And I do not see that happening widely.
Now,
Sadly, I don't.
let me ask you both. There was supposed to be a peak of some sort when the cases in the US finally crested, and then we would eventually see this begin descending, but we're not there. Why not? Dr. Giordano, could you take that?
Well, what I would say is those models are based on looking at the past and looking at what other cities in the world went through, and they're really well done, but they are just projections into the future based on what the past looked like. And what's happened in the U.S. is, if you look at the country as a whole, there isn't one epidemic. There are a lot of smaller epidemics, some much bigger than others, but there's no single U.S. epidemic or pandemic. New York and the Northeast got hit very hard, very quickly. Some other places, like Texas, are just now seem to be rising. And there are a lot of factors that go into that. And the models are imperfect and have to assume sort of behaviors that may change. So if a model takes into account the effect of physical distancing or stay-at-home orders, well, those things are not static. People change their behavior, both in response to what they need and in response to what the authorities might say and in response to what they want. Mm-hmm. And so the models are only that, they're only projections. But the epidemic, the pandemic, is clearly not a universal monotonous epidemic across the country. It's micro epidemics.
Dr. Jenkins, do you believe that states are getting the right kind of data to make informed decisions on how the states should move forward?
Well, I can't speak for other states, Mabel, but I can speak for South Carolina. I think our South Carolina DHEC has done an amazing job of rising to the occasion over these last several months. I believe that they are working with the data that they have at hand. Fortunately, here in South Carolina, we have a healthcare delivery partner that covers 2/3 of our state. So we are able to pretty well track those hospitalizations and bed capacity over at least 2/3 of our state pretty consistently. So I do think here that we have that. We are watching very closely the numbers go up, but I do think we are heartened by the fact that our hospital systems have much capacity. We are not seeing what we saw back at the end of or early mid-March. And so that is, for me, very heartening about this disease.
Mm-hmm. What about the endemic phase of the infection, something that we see with chickenpox, for instance, a containable level where we could remain for long-term, a long period of time? Dr. Giordano, could you explain what that would mean for the coronavirus going forward?
Well, yeah, sure. We currently there's widespread transmission, there's widespread susceptibility, and it's a pandemic. It's going to be with us for years until there's a vaccine. I can't speculate as to when a vaccine precisely is going to come out, but it's many, many months, and it could be a couple years, and time will tell. So we have to learn to live with this virus. Herd immunity is not going to develop anytime soon in any population in the U.S. To live with it, we need to be smart. We have good tools to turn this into something that is contained, more of an endemic than a pandemic. We have those tools at hand. They're physical distancing, masking, hand hygiene, and reducing activities to those that you consider priority events. Whether that's getting healthcare, whether that's an important social event, whether that's your job, your education, we all have our decisions to make about what's our priority, but we can't resume normal life as we knew it until we have really a prevention, which is going to require a vaccine for the virus, as I see it.
I see. Okay. And Dr. Jenkins, what does that mean, the living with it? Can we go to restaurants? Can we go to places and gather with more than 10 people? What do you think about that?
I think at this point, the plan that was put out by the CDC of the phased-in reopening of the U.S. was very well presented. I believe that we need to look at those guidelines and look at where we are at in our particular state and follow the phases that we are in. Restaurants, some restaurants are doing this very well. Every other table is empty. They're roped off. You cannot sit there. The servers are wearing masks and gloves. And so I do believe that there are some people who do it well. And then Mabel, you and I have seen the pictures, and there are some that just are not doing it well. And those are the areas where they may believe we are back to normal. We are far from normal, and we are so long away from being, quote, normal. What we need to do is be smart and be safe. Wash your hands, wear your mask, socially distance. Continue to do those things as you can. There was a proposal at one time that we could, cohort with close friends, right, and family, and we could expand our circle, and that would be the circle that we would, interact with on a more routine basis. But we didn't implement that, and I believe that people are now just going back to business as usual, which unfortunately, as I just keep going back to, is about public health, public service messaging, and all of us being aware and reminding people that this is the way our life is for right now.
Mm-hmm. Do you have something to add to that, Dr. Giordano?
Well, my career has been in HIV, and I've learned pretty early on that people don't respond well to absolutes. So a lockdown is an absolute, and no one likes that. People can do that for a short time. No one likes to be told that they must abstain from whatever it is forever. So we have to come up with reasonable solutions to allow people to go to work and to go to school. And I think we have a lot of those tools. And if we can agree that everyone wants some economic recovery and everyone wants their kids to go back to school, then we can agree to implement the tools. We need good leadership, we need good messaging, but a mask is not a political statement. A mask is a tool that should be used to allow society to resume some sense of productivity and education and safety. And I think that's the message I would put out.
And do we have any indication of how the protests that we have seen across the country in recent weeks, how those gatherings will impact future numbers? And also we have a big gathering coming up this week too.
I think my take on the protests, fortunately, most of them were outside. There's an early report that I just saw this morning from Minnesota saying maybe not seeing an increase there. That would be great, but we don't know. Clearly, an outdoor event is safer than an indoor event, and an event where people mostly are wearing masks is safer than an event where most people are not wearing masks. But I don't know. I don't have a specific answer.
And I don't think we really intentionally tracked by asking patients, did they attend a protest? I think we gave them the courtesy of not asking that question. And so we don't really have the data, but we are not seeing huge explosions in numbers, as Dr. Giordano said, around large cities where we knew there were ongoing large protests day after day, night after night, which really lends itself to this idea of being outdoors, not in a contained environment. That also is helpful to prevent the spread, to be outside.
Okay, well then I need to ask, as we get past the summer and the fall, we're going to be heading into the winter months. Is that a concern if we don't have more aggressive containment? What do you think, Dr. Jenkins?
So I would actually say that I believe we will know that. I hope, Mabel, that you and I talk again in about November or December, because I believe that we're going to know a lot more about this disease. We may even have the beginnings of a promise of a vaccine. We know that the government is already producing hundreds of millions of a vaccine that is not yet proven to be successful, but they are preparing those. And Dr. Fauci let the public know that. So I believe that we have promise coming, but going outside in large numbers, you're right, is not going to be feasible in the winter, which is why I hope, again, just repeating what Dr. Giordano said, that we get it right. If we get it right now, then we can risk mitigate better later. And that's really our hope, is that we get it right now. And right now is, we have the fortunate, the good fortune to have warm weather and sunny weather and people can get outside, but that won't be the case in the winter. You're absolutely correct.
Okay, and the final word goes to you, Dr. Giordano.
Well, I agree with Dr. Jenkins. The winter will be interesting, and if we have a vaccine, that would clearly that would be a great and incredibly rapid advance. Without that, it does worry me. People will be back indoors for the most part. I would add, though, that the one tool that is out there that isn't fully implemented yet is contact tracing, and with good contact tracing, things could be even better. So if you add, you have your mask, you have your hand hygiene, you have your being responsible with limiting your activities to those that you deem essential, and then you have without quarantine and without shutdown, and then you have your physical distancing when you do go out. If you add onto that good contact tracing at the public health level, that could really make a big difference come wintertime. But people are still working on that. And that is the one tool that we haven't quite implemented despite letting the lockdowns ease. So I hope that is in better shape. And I hope people don't politicize that tool as well, because it is really all about trying to protect everyone in the community from this pandemic.
All right. Thank you, Dr. Thomas Giordano, Head of Infectious Diseases at Baylor College of Medicine. Thank you to you, and also to Dr. Marjorie Jenkins, Dean of the University of South Carolina School of Medicine, Greenville. I'm Mabel Jong. Thanks for watching HD Live, the streaming video service of Health Day News. Check us out at live.healthday.com, Health Day's YouTube channel, our Facebook page, and on Twitter via Health Day Tweets. Have a safe and healthy weekend. Thanks again for watching.